Good morning. I guess it's afternoon. Happy Tuesday. Thanks for joining. I'm Dr. Burns. This is the Change Your Smile, Change Your Life implant seminar. So if you signed up for this and are joining, I do appreciate it. Hopefully today will be incredibly knowledgeable. You get a lot of information about implants and some of the other options that are available to you. If you're not if you're missing a teeth or something and don't have, or not sure that you want an implant, then we'll also go over some of those other options for you. We are going to have a question and answer session at the end. So if you do have questions, and I hope you do, feel free. You'll be able to type them in and I will do my best to answer them. I am only answering questions about teeth or implants. So let's get started. And I will be clicking through the slides. So here, my name is, again, Dr. Burns. I'm a graduate from Indiana University, longtime Hoosier. I have done continuous education in multiple fields, but implants in the last 10 years, I've been doing pretty consistently with surgeries and stuff for patients. My background's in cosmetics and rehabilitation of mouths. We have several doctors between the two offices, and between all of us, between all the two offices and all the doctors, we're able to do just about anything. So we like to say it's all the services under one roof. So whether it's cleaning, dentures, implants, surgeries, orthodontics, Invisalign, we're able to do that between the two offices with all the doctors that we have. So we're pretty proud about that. Again, two locations right now, Sun City West and Sun City. We are in the process of adding another third location due to the demand. So we will be announcing that pretty soon. We're pretty excited about that. So the information seminar is really important because we think it's important for all of our clients to have a ton of information, right? We know that there's needs and wants and desires that our patients have. And we feel it's our obligation to diagnose and then give you all the options, give you a bunch of information so you're able to make the right decisions for yourself. And that's really, really important. And so this type of seminar really helps because it gives us a little bit more time. It gives you, the patient or the client, a little more time to process that information and make decisions accordingly. So let's talk about it. Let's jump right into implants. There's all kinds of implants: hips, knees, shoulders, teeth. It's a titanium structure, and it's made to mimic the natural shape and function of the root of your tooth. Now, a lot of people think that the implant's the actual tooth. It's not. It's the root structure of the tooth where the tooth would go on. So in this photo right here, you can see the metal object to the right. That's the implant, but it closely follows the shape and positioning of your natural root. So it's why they were so successful and why they work so well. They haven't been around for a long time. They've gotten really popular in the United States, dental implants in the 80s, 1980s. But we've found bones and jaw fragments from almost 3,000 years ago where they were having dental implants placed. And in this particular case, they've used shells, they've used gold, they've used wood. There's been a lot of different things that have been pushed into jawbones to use as teeth. So this isn't anything that's relatively new. Just the technology, the materials, the science behind it is relatively new. It's been a well-kept secret for a long, long time. Dental implants were incredibly expensive, and very few could afford it, but that's drastically changing. You may or may not recognize this gentleman, a famous actor, but you can see how dramatic implants can be for you and how they can change your smile. He was already very handsome, but it drastically changed his before and after by getting his teeth done. And we'll show you some cases at the end that will also demonstrate some of our clients, the before and afters. And I think the biggest takeaway from this, hopefully, is that you realize how important teeth are. But if you're not going to have teeth or you're going to lose teeth for whatever reason, there's drastic consequences, and having something to replace those missing teeth is going to be super important for your overall health and appearance. Never been a better time. This is a great time. The technology and materials with 3D printing and the scanning and the 3D scans, the imaging that we can do, the things that dentistry have today, it's just no better time to do this. The advances in technology are fantastic, and the materials are fantastic. The healing times are shortened. The longevity of the processes, the length that they'll last is better. The cost has come way down. We've invested a ton of time in the materials and the equipment and be able to do a lot of things in house that can save you as somebody that has to pay for those services a lot of money, because now we don't have to go through other people to get that and have those extra expenses. So we're going to talk a little bit about losing teeth and what the consequences are, because that's super important. The benefits of dental implants. What are the other options? So again, we want you to know what other options you have other than implants, because implants aren't for everybody, and we understand that. How to get your smile back, your confidence, how to be able to chew and eat food and enjoy life a lot better with teeth. Effects of missing teeth. There's socially and emotionally a bunch of different reasons why teeth are important. We smile, we laugh, we talk, we chew and eat all day long. But there's some, so it's super important. Your overall health is dictated by the foods that you eat and how you're able to digest those. So you may even, be eating or trying to eat the right types of foods, but if you're not masticating or chewing those foods properly, then your body isn't breaking it down in the right way, and you're not getting the necessary nutrients that you need. So teeth are super important for that. And just overall, and again, we'll show some of the pictures of how not having teeth or missing a few teeth here and there, how drastically it changes your appearance, how drastically it ages you. It's really quite impressive to see the before and afters. We get a lot of concerns. The biggest ones are they're tired of dealing with their teeth. I'll elaborate that on in a minute. They can't eat. I mean, that's another big one. They can't enjoy the foods that they really, really want. They're not getting the nutrients. They're embarrassed by how they look. And, we have a lot of people who come in who are just embarrassed by the way that they look and are tired of dealing with it. Go back to the first one a little bit, tired of dealing with teeth. And what that means is that dentistry, just like medicine, the things that we do, unfortunately, don't last forever. And depending on when you start having dental problems or when you start dealing with dental problems, the longevity of certain things, they only last so long. And so sometimes we have patients who may have done a bunch of crowns or a bunch of bridges several years ago, and it's starting to fail because it does have a life cycle. Or they've been dealing with periodontal issues or gum disease issues, and that is reoccurring, and they're getting it again, and they're losing more bone, or they're having more infection or more disease processes. Sometimes, you have to ask the question, when's enough? Are you going to keep repeating this cycle, investing all that time, all those finances into something that ultimately might fail anyway? And is there other options that, number one, will keep the cost down over the long term, but provide you the smile, the function, the health that you want and deserve right now? And so those are some of the things that are super important. And we're starting to see a lot more of the first one, where people are just tired of dealing with their teeth, tired of investing tons of money and time, coming to the dentist all the time, and still, with all that, still having problems. We're living longer. And so with that comes consequences on health, consequences on body parts, especially ones that have been replaced. Again, things just don't last forever. So the big thing when you lose teeth, and this is super important to realize, whether it be one tooth or all your teeth, bone likes stimulation. It likes to be stimulated. It likes pressure and tension applied to it. It turns over when that happens, and it stays nice and healthy. When you remove teeth, for whatever reason, you lose teeth, there's nothing in the bone to stimulate it. And so over time, bone shrinks away. Now, in women, unfortunately, that happens a little bit faster than men, but in both, as we get older, it speeds up. Now, the other important thing is a lot of times people remove their teeth and replace it with acrylic or like a denture or a partial denture. Studies have shown, now we know that actually even speeds up bone loss even faster. And so what happens is as you lose bone, you lose facial height, or your face starts to shrink. And so in this slide, you can see as you progress from left to right, how the face collapses. The patient doesn't age, but the face collapses, and it gives the appearance of an older appearance, just because of the lack of bone. There's also a lot of anatomical considerations to consider, and as the bone melts away or shrinks, other anatomical considerations like your nerve, your sinuses, those kind of things can become a problem. And you'll see in a slide where, if the nerves become a problem, now not only do we not have the bone, but now we have to deal with some of these other anatomical considerations. This is that slide right there. And what you're looking at here is the two lines, and the top red line, the one that's U-shaped and curved, is where the bone has shrunken away. And if you look to the left side, you can kind of see, I don't know if you guys can see my arrow right here, but the bone, how high it is here and how it drastically drops on the other side due to not having teeth in there. The lower red line in this photo is the nerve. There's a big nerve that runs through that jawbone. So in this particular case, if somebody wanted an implant right there, you can see where we're running out of bone. We don't have height. We don't have enough room to put an implant in. If we did, we'd run into that nerve. And of course, we don't want to do that. So losing bone is a big problem. We talked about this earlier, but again, not being able to chew and eat the foods that you want is super important, because we like to eat and we like to enjoy food. But it's also really, really important for overall health, to get the right nutrients, to digest food properly, to ensure our gut health. All of those things are super important. Mayo Clinic did a study a few years ago, and people who keep their teeth live longer, and it's because of the ability to get those nutrients. It's because of the ability to be social and enjoy life, and for that they're living longer. So super important. So let's talk about options. We're going to talk about several different scenarios: missing one tooth, missing several teeth, or missing all of your teeth. Now, these options don't mean that this might be particularly you, or an example of exactly what you may or may not have, or one of your loved ones may or may not have going on. But these are also what if scenarios. So what if you just got hit and lost one tooth? What would be your options? And so again, we're going to go over implants and the pros and cons, but we'll also go over some of the other options and the pros and cons for those as well. I will say they are the standard of care now in dentistry. I mean, for years we've been doing other things, including implants. But if you are missing a tooth, or going to be losing a tooth, an implant is the standard of care in dentistry, before bridges, before partials, before anything else. Decreased healing times. Again, we talked about this. Titanium is easily accepted by the body. Hips, knees, shoulders, all of that uses the same type of material. And they're the most successful thing that we're doing in dentistry today, dental implants. All right, now we're going to talk about your options. I jumped ahead there a little bit. So we're going to go over single tooth, multiple teeth, and all of your teeth. So let's talk about one tooth. This is a picture of a client, and this is a front tooth. On the picture on the left, you can see where the tooth was broken off. And we see this every day. Trauma, cavities, breakdown with the teeth. For whatever reason, you're just losing one tooth, and the surrounding teeth around it are in good shape. Everything's nice and healthy. So let's talk about the different options that if you came to Burns Dentistry that we would review with you. Option number one would be a partial or a flipper. There's a couple different designs of it, but what it is, it's a removable device that goes in that replaces the missing tooth. So you can see the plastic material here has these little metal clips. The metal clips then would fit onto the teeth. This tooth would slide into place, giving you the appearance that you had a tooth. This is the fastest, easiest way to replace a missing tooth. However, as you can see, the cons for this are quite large. I call these party teeth. They're the type of thing that you pop in when you're going to a party. You want to be sociable. You're going to be out in public. So when you smile, talk, laugh, you have a tooth there. It is not a functioning tooth. It's not meant to be biting into things, chewing hard on. It's plastic. It's attached by plastic, and there's literally hardly any strength to it whatsoever. So I have seen these last several years, but normally we do this as a temporary basis to get a tooth in there quickly, to give them something that they can wear, and smile and talk and laugh. We wouldn't do one of these types of things for the back teeth. This would be literally just for the front teeth. Again, it's a party tooth. Most people can't see your back teeth when you're at a party or talking or trying to be social, business venture, whatever that might be. The clasps wear down, the teeth wear down. You will continue to get bone loss if you keep this in long term, because you don't have anything into that area where it's stimulating bone. So you'll get more and more bone loss as time goes on. And again, the biggest thing with this, though, you have to take it out normally to eat, and nobody really wants to do that. For years, the most common was the fixed bridge. The fixed bridge is where the teeth on each side of the missing space are ground down, and a bridge is made that's cemented down over those teeth. Now, this can look absolutely fantastic. It can be done in little as 2 appointments. It can last on average about 20 years, give or take. I've seen them last 6 months, and I've seen them last 50 years. So these can be really, really good. The downside of these are that the teeth on each side of the space have to be ground down. And so, anytime we're causing more trauma to teeth, then that can further lead to more problems later on down the road. So that's the biggest thing. Again, you're still going to lose bone. The lifespans of these are a little less, 5 to 10 years with these. And the reason the lifespan's less, or 5 to 10 years and not longer for these, is that because usually when bridges fail, it's because you get cavities or breakdown underneath the bridge. So just because you have a crown over a tooth, that doesn't mean there's the tooth is still there. So you can still get cavities. You get recurrent cavities underneath the bridge. And if that happens, then the whole bridge has to be taken off and replaced. And so over a period of time, this can become a very expensive option if you have to keep replacing bridges every 5 or 10 years. But the biggest one is just grinding on those teeth. That makes it not the best option. And then you have the single implant, of course. The beauty of this, it can be completely natural looking. It's going to preserve the integrity of the bone. It's not removable. It's as strong or stronger sometimes than your natural teeth. These can last 20, 30, 40 years. You're never going to get a cavity on these. They're not going to move around. They're going to help position the other teeth and keep other teeth from moving. There's just a lot of pros to this. In the past, one of the biggest cons has been the price. But like I said, with the technology and stuff that we've implemented, we've been able to bring this cost way down. And so if you compare a single implant with a crown to the bridge, the previous one, they're almost right in line to being exactly the same. So I would say the biggest downfall right now of a single implant is it takes a little bit longer to complete. So you just don't put the implant in and add a crown. And we can talk a little bit about that if you have questions regarding, the teeth in the day and that kind of stuff. We'll get to that, and I'll take questions on that if you have some. But to put a single implant in there, you're usually waiting a couple months at least to get a crown on top to get your tooth. So this is an actual case of mine. A patient came in. It's really, you're not going to, you won't recognize this, but the tooth on the left that has the black line around it is actually a fractured root. She came in pain. This tooth had been fractured. She got hit. So she was going to lose this tooth. We placed an implant. You can see this is the x-ray of that exact tooth. The implant's placed. A few months later, we had the abutment and crown on. And at the end of the day, she's back to normal. With another beautiful tooth. Her smile looks exactly the same. And that would be a single implant replacement of her smile. It can be very catastrophic if, to lose a front tooth. It's a little bit different when it's a back tooth because most people can't see it. But when you're losing a front tooth, it can be a rough situation. And so knowing that we have this available to us, and we can do this kind of artistry is awesome. So we're going to go into several missing teeth. Obviously, on the left, we've got a lot of missing teeth here. What are we able to do with implants or other options to get teeth back into place? So this is a scan of an upper and lower jaw. It's not the previous picture, but it just kind of shows you where you have some teeth. There's definitely teeth that are going to be lost or they're already missing. The classic, been around for hundreds of years, is what we call a partial denture or a removable partial denture. As you can see in this photo, it has a metal substructure. It's replacing the plastic teeth on each side. It does have the clasps that come up and grab onto the existing teeth. That's where it gets its strength. That's where it gets its retention so it can snap into place. This is the fastest, least expensive way to get teeth. These can last a long time. I've seen them last, 10 years, 15 years, but on average they last, but the ADA says on average they last about 5 years. And the reason for that is because they're removable and because of the clasps that are pushing on or grabbing onto those teeth, those clasps are putting forces onto those teeth that the teeth aren't meant to take. And so if you use an analogy of a tooth like a fence post, your teeth like to be jumped up and down like on top of a fence post. Teeth do not like to be wiggled back and forth. And then just like a fence post, if you keep wiggling a fence post back and forth, ultimately you lose the fence post. Same with teeth. These clasps are constantly, as you're chewing and eating and talking, they're constantly wiggling those teeth. And ultimately that causes failure of those teeth. You end up losing those teeth. Thus the partial's now in trouble and you've lost more teeth. And so now we're kind of back to square one. So we really call this a short-term solution. It will eventually result in loss of more teeth. You will continue to lose bone faster in the areas where you don't have teeth. And sometimes, unfortunately, the clasps or the metal things that grab onto the teeth you can see. And so, we have to take that all into consideration. The other one would be an implant bridge. So same as a single tooth implant, this is where 2 implants are placed or 3, depending on the situation. And a bridge is made that spans the 2 implants, replacing the missing teeth. Again, with the implants, because the implant's in stimulating the bone, we're gonna stop the bone loss. It's gonna look incredibly natural. It's gonna feel like natural teeth, allow you to eat everything. It's not, you don't take it in and out. Again, the cons in the past have been cost and time. And we've, again, tried to bring cost way down to make it more reasonable and feasible for everybody. But we can't fix the time thing yet. So there is a couple months waiting period again before you do something like an implant bridge. This is a case, again, another client of mine who came in who needed multiple things done. But, you can obviously see the 3 teeth that we couldn't save in this particular picture. And this is how she ended up. And again, going back to the 3 teeth, you can see this tooth and this tooth and this tooth are implants, bridges that we did for her. So it turned out fantastic. And looking at her smile, looking at her mouth, you wouldn't be able to tell. This is another case of the lower. And again, these teeth are all going to be removed. And we're going to be doing some individual implant bridges. And ultimately, when it's done, her mouth looks brand new. And you wouldn't even be able to tell where the implant bridges are located in her mouth. Here's a case before and after with implant bridges. So you can see the difference in how life-changing this can actually be for somebody. It's fantastic. Let's jump to missing all your teeth. Missing all your teeth, we're seeing more and more of these days. And now, and when we talk about missing all your teeth, this doesn't necessarily mean that you are missing them right at this moment, but that due to trauma, due to caries, due to gum disease or periodontal disease, or due to the fact that you're just tired of dealing with teeth, we know that this is where ultimately we're going to go, is that we're going to end up with no teeth. And if we're going to end up with no teeth for whatever reason, what are the options to replace those? So let's go through those. Number one would be dentures. Um, the people who have had dentures that come into my practice, and I see a ton of people with dentures, but the people who enjoy wearing dentures are ones who've had them for 50, 60 years, who really have no idea or just don't remember what it was like without them. There's some, unicorns out there who have great bone. The dentures, have the same dentures for the last 30 years, but that is very, very, very rare. The majority of the time, there is constantly issues with dentures. So we'll go over some of those so you're aware of what's going on. They are the fastest, quickest way to get teeth, though. So if and that's probably the one benefit of them, is that if you were going to lose your teeth today, we can literally get dentures made and get them in there in a couple of weeks where you'll have teeth. So that is a benefit. It is the quickest thing to do. But we'll go through the cons. I've listed a couple different cons here, but there's tons, and they keep growing. They can be incredibly uncomfortable. Most of us are not used to having things covering our ridges in our mouth. They can be big, they can be bulky, they can interfere with the way that we talk, the way that we eat, the way that we chew, how food tastes. We talked earlier about putting acrylic on bone. You're going to speed up bone loss. The majority of these have to be fixed or relined or added material to them every 3 to 5 years. About every 10 years, they have to be remade. The teeth wear down. There can be lisping problems. The list just goes on and on. As we get older, our mouths tend to dry. As we take more medications, we get drier mouth. If you have dry mouth, these start rubbing more. So you have plastic rubbing against dry tissue in the mouth. It just becomes a really big problem with dentures, especially at an early age. You're going to speed up bone loss. It'll eventually get to the point, and it's funny, I just had a client, it's not funny, but I just had a client this week who came in whose bone loss is so severe that not only can we not put implants in there, but she can't wear her dentures at all anymore on the top or the bottom. She literally can't keep them in. And so it really puts us in a bind of what are we going to try to do to help this poor woman, and how are we going to get it so she is going to be able to eat and enjoy food as long as she wants to enjoy food. And it's becoming a real challenge. So, dentures are a quick fix, but usually not a very long-term solution without a lot of problems. And again, the cost of these, depending on how many teeth you have, depending on how many times you're going to have them remade or relined over the course of years, can get really outrageous as well. Some more, again, makes you feel older. And you can read these. Affects speech. I think we talked about food. As you lose bone, you can start to expose the nerve. I think if you remember that picture I showed you, the 2 red lines, as that bone starts to shrink down closer and closer to that nerve, the denture will press on that nerve. And we'll have a lot of people who come in with their dentures and it hurts when they chew. And the reason it hurts when they chew is because that nerve is now being exposed. And so every time they bite, it's just getting pressed on and it's uncomfortable. And that nerve used to be protected with bone. So again, another huge problem. A step up from that would what we would be calling an overdenture. So we've gone from a denture to now an overdenture. And an overdenture, or you may have heard it like a snap denture, but an overdenture is where now we'll go in and just place a couple different implants on the bottom, or maybe 3 or 4 implants on the top. And on those implants, then we can take a denture and add little snaps. Ball and hitch, if you think of like a ball and hitch on your truck. But once the implants heal, then we're able to snap it in. Now, this does a lot of things. It does provide more retention. And one of the things with just regular dentures is that as they get loose, as you're talking, as you're eating, as you're speaking to people, your muscles are moving and they're moving the dentures around. But having a couple implants in place, we're able to snap that on, and now there's less movement. Now, it's not movement free, but it does decrease the movement of the denture. With dentures, you're going to get food and debris underneath as you eat. With these, you will do the same. The same things about dentures still apply to these overdenture, meaning bone loss where you don't have implants now, having the teeth remade every 3 to 5 years, or I'm sorry, 10 years, having them relined. Some of those things all still apply. They're still made out of the same material, but at least we have some kind of something that we can snap onto in the mouth that helps keep them in. You will prevent bone loss where the implants are, but anywhere where there's no implants, you will continue to lose bone. And then the next one, single implant replacement. And I've done a couple of these in my career where you're going in and every tooth or every other tooth you're replacing, or you're placing an implant, and then on that implant you're able to put crowns on. And if time and money weren't an issue, this would be the best way to go for everybody. The problem with this, time and money are usually an issue. These can take a long time to do depending on your bone, and they can get incredibly costly. If you think about putting 28 implants in or 20 implants in and crowns on all of those teeth, it can get up there pretty quick. But another big one though, and I think that the problem that I have with something like this is the time. And sometimes it's taken as long as 2 years from the beginning to the end due to the bone, due to anatomical considerations that just don't make this necessarily a really great value in the short or long term. And then we have a hybrid option. And this is very, very popular, very common right now. This might be, it's advertised sometimes as teeth in a day, and I'll explain that to you a little bit. It's a little bit mislabeled when they call it teeth in a day, but this is where we don't have to do every tooth with implants, but we can do usually 4 to 5 to 6 implants per arch, so top and bottom. And on that, then we can bolt teeth down on. Those teeth will be non-removable. They don't come in or out. You can chew, you can talk, you can taste food like normal. It's, like I said, bolted on. So once it's bolted on, you physically can't remove it. It stays in there. So it functions just like real teeth. It looks like real teeth. It's made out of high porcelain, very strong porcelain material. So it looks fantastic. Pretty much can have any smile you want. It can chew and eat just about anything you want. It's just like having your real teeth without doing a ton of implants, but also not doing plastic denture teeth. So let's talk about the teeth in the day thing, because a lot of people have questions about that. The day of surgery with this option, and only with this option, what's really cool about it is that we can place the implants and bolt temporary teeth down onto those that day. And that's where they're advertising teeth in a day. That's where that comes from. You would come in that day, you would leave with teeth that are bolted on. Those are temporary teeth, however, and that's not what they're telling you. Meaning the final teeth, or the really hard porcelain-like teeth, happen after the healing phase, usually anywhere between 2 all the way up to like 6 months of healing. So once that healing occurs, then you come out of your temporary teeth and into your permanent teeth. Those permanent teeth are the ceramic zirconia type teeth that are then also bolted down on there. So teeth in the day, it's not your final teeth that day. It is temporary teeth. But the good news is you're not going without teeth, and you can go out and function and while you're healing. So the reason I really like this as opposed to some of the other ones is that it allows our clients to test drive their temporary teeth. And what do I mean by that is that the day of surgery, you take home your teeth. We will have sat down and talked about the smile that you want, the color, the shape of your teeth, anything that you want to change. And we'll do that in those teeth. So you'll take those teeth home bolted in. You get to test drive them. Because they're temporary and because we know we're going to change them after the healing, you can test drive it, and anything you don't like about those, then we can change when it's time for your finals. So we change the color a lot. We change the positioning. Some people want spaces initially, and then they decide they don't want spaces, or whatever the case may be. You get to test drive it. And I really like that, because anytime you're doing something drastic like removing your teeth, or you've lost teeth over time, you're not really sure how your smile is going to look, or you don't remember how your smile should look. And so this is cool because it allows you to smile, function, talk, eat, get out in the world and test drive it. And if you don't like it, we have time, we can change it. And we can test drive that and make those changes. And so we know that you're going to be 100% happy with the look and the feel, your smile out there in the real world. The downfall of this, time. Again, implants, I think the biggest thing is time. And even though the teeth in the day is floated out there, just keep in mind, it doesn't mean the implant is healed in a day. It doesn't mean the implant is ready completely in a day. It can take 4 to 8 weeks. We're doing, depending on the type of bone, the quality of bone that you have. Sometimes it can even take longer than that before we're in the final teeth. Here's a case of a client. Again, this particular client was just tired of dealing with teeth and had crowns and bridges and multiple things. You're just seeing the front, but on the back teeth as well, was dealing with gum disease and decided to do a hybrid. This is a retracted view, so you can kind of see what the hybrid would look like. The gum tissue blends in with your natural gum tissue, but then getting all your teeth bolted in. Again, another case with a smile, and then after, this was an upper hybrid. And this is where we're talking about the age. If you look at some of the before and afters of these cases, how drastically different the appearance of these people are. And all that's really changed is their teeth. This one's in glasses. But it's dramatic. It's life-changing, an absolutely fantastic result here. And this is an upper lower teeth. So we get the candidate a lot. Am I a candidate? Everybody's pretty much is a candidate. It just depends on what's necessary to happen to get the implant in. And what I mean by that is that you can have different amounts of bone, different quality of bone. You can have things that are in the way, like sinuses or nerves, but it doesn't mean you're not a candidate or you still can't get the implants. It just means that there might be a little bit more work that's required in order for you to get one. The big things that we try to avoid are smoking, uncontrolled diabetes, pregnancy, and HIV. Those four things. Diabetes doesn't mean you can. It just means that we have a little bit less healing capabilities, and it might take a little longer. We might be at a little higher risk for failure and those kinds of things. But those are the big ones. So everybody pretty much other than that is a candidate. How long does it take? It's all over the board on how long it can take to put a single implant in. It can take, you would be here about an hour. The actual placement of the implants can take 10 minutes, 30 minutes, somewhere in that ballpark. But again, there's that waiting time while the implant has to integrate into the bone, while the bone grows up around the implant and grabs onto it. And that waiting time, depending on your bone, can be anywhere from 3 weeks, as long as 9 months. Usually it's not that long, but it's, we try to give a window. We usually will know once we get in and examine the bone and know what quality of bone that we have, then we'll have a better understanding of what we can tell you on the healing time will be. Success rate, we talked a little bit about this earlier. It's 98% successful. If we go into it knowing you're a good candidate and you don't have any of those underlying medical conditions, and you can take care of it, then the success rate is going to be really, really high. There is a small failure rate. And again, in medicine and dentistry and everything, there is a failure rate for everything. Nothing is 100%. Unfortunately, we hope and want for ourselves and our loved ones that everything is 100%, but it's just not the reality of it. And so why do these things fail? And the biggest one is, if we take out smoking, usually the implant, we want bone to grow around the implant, but sometimes gum tissue grows around the implant, and the wrong part of the body grew against the implant. So we wanted bone, but we got gum tissue. Gum tissue doesn't hold up very well. So in those particular cases, sometimes we have to go in, clean up the gum tissue that grew around it, and place another implant or place some bone around that. That's the number one reason. We can get infection around them just like your teeth. So that's another reason during the procedure or after the procedure, there's an infection process that causes the implant to fail. You can overload the implant. So I like to use the analogy of an implant. It's like putting a post in concrete. And if you put the post in concrete and you decide that you want to wiggle the post before the concrete sets up, it's not going to stay. The post is going to come out. And it's the same with the implant. And that's why I said the teeth in the day on a single tooth is not a good idea at all. We don't want to put a crown on a single implant that day, because you're going to start loading it or you're going to start chewing on it that day, and the concrete hasn't had a chance to set up. And so that would cause a failure. Again, uncontrolled diabetes. But there is a small percentage that we just don't know. The bone was great. The health is great. The implant, everything went perfectly well, and it still fails for whatever reason. That's a super small percentage. It's 5 to 10% of the 2% that failed. So super, super small, but it does happen. And sometimes we just don't know. Most of the time, that being said, majority of the time, it's just a matter of going in, taking the implant out, cleaning things up, and placing another one, and letting it heal. So in our practice, we guarantee the work. If everything goes and you're a good candidate, bone looks good, we guarantee all the things. So we would just go back in, clean it back up, and get you another implant. Care, and depending on your situation, if you have implants or you're going to get implants, there's specific things. We try to individualize all the home care for whatever your needs might be. And so there's all kinds of different devices, water picks, attachments, different flossers, different toothbrushes, different rinses. And so depending on your needs, we would sit down and say, okay, given the circumstances, these are going to work the best for you to maintain those. It is important to know that I mentioned that implants can't get cavities, but implants can still get gum disease. You can still run into problems. And so I don't want you to leave here thinking implants just means you never have to deal with your teeth again. There is a maintenance with those implants, and so they do need to be taken care of. Do they hurt? Implants don't necessarily hurt. So the surface of bone has nerve endings, and the tissue around the bone has nerve endings, but internally bone really doesn't. So usually the surgical procedures are minimal. I do tell patients, depending on the procedure, we're just doing one implant. It's going to be sore for a couple of days, but it's not going to keep you from going on the golf course, and it's not going to keep you from doing, everyday activities for the most part. Now, that's barring any major infections and all kinds of other things that you might have coming into the situation that might change that. So on average, though they're not, most over-the-counter medications can take care of it. Usually we prescribed a pack of stuff that helps before, during, and after the surgery to make sure that you're minimal pain, minimal discomfort, quick healing, all those good things. Investments are, again, going to be different. What will happen is that we'll get a scan to determine the type of bone, what's going to actually happen. And from that, we'll be able to say, are we just placing an implant? Do we have to grow bone? Do we have to lift sinuses? There's a whole slew of things. And so it would be really, really hard. We do have implant specials all the time. I'll show you a special here for the hybrid at the end. But it really depends on your specific situation on how much the implant would cost. We do quote the fee with the implant, the abutment, which attaches to the implant, and then the crown that goes on the top of it. So that's an all-inclusive. We're not trying to say, well, here's the implant fee, and then there's this added fee and this added fee and this added fee. So we can give you that information depending on your needs. And again, the process is, once we have a comprehensive exam, once we've gone through and sat down and talked to you about your desires, both short term and long term, then we'll be able to customize a treatment plan for you that says, okay, here's what you said you wanted to do. Here's what you wanted ultimately to be able to function like and look like. Here's what we can do. We can go over the fees at that point in time, get all the necessary data that we need, plan the surgery or the implant out, and do it. So it can be done very, very quickly. So I guess the last thing, and I think you could see it on some of the pictures that we showed in our clients and their faces and their smiles, this is a life-changing thing. Whether it's one tooth or multiple teeth or all your teeth, it has drastic consequences when you're missing them, and getting the teeth back, getting the function back, getting your health back, getting your confidence, your smile back is huge. And it literally, I can't tell you enough, if you're one of those people out there that are thinking about any of that, how life-changing this can be. Yes, there's an investment of time and energy and money in getting your smile back, but we've never had anybody say that it wasn't worth it. Everybody has said it's worth it. And as you can see down here, they usually say, I wish I would have done it sooner. So again, no better time to do this. Here's the special for the hybrid. Just gives you an idea. We're taking $10,000 off of an arch. So if you're interested in this kind of situation, this isn't for everybody, but if you're interested in something like this, give our offices a call. They can set you up with a free consultation. You can come in, talk to me or one of the other surgeons, and we can, figure out what it is that you want, what you're looking for, kind of diagnose what's happening, and go over the different scenarios, different options for you. And if this works, this is something that you're interested in and you worked in, it's going to save you $10,000. So you can't beat that. And again, this is why we do what we do. People love to be able to eat. People love to be able to smile, be happy. It is a life-changing experience. And so I will try to take some questions here. I think they are, if you guys have anything, you can type them in and I will do my best to answer them. Do you guys offer sedation for patients who are anxious about going to the dentist? Yes, we offer multiple ways of being sedated. Number one, just down to the basic laughing gas, which a lot of you may or not have, but it's kind of a very light, bubbly feeling, just kind of takes the edge off. We do offer conscious sedation, which is a form of, you'll come in and you'll pretty much just want to fall asleep, but it's not like an IV knocking you out type of sleep. We do that very frequently. Because the beauty of it too is it has a post-operative amnesia effect, which means you'll go home, take a nap, wake up, and you won't remember your appointment. You won't remember a whole lot of anything. You might remember like driving up or having your ride bring you. So that works really, really well. A lot of our clients go that route for regular dental work and for implants or surgical procedures. And then we also offer IV sedation. We have anesthesiologists, nurse practitioners on our team who you can come in, get an IV, go to sleep, wake up, and the procedure's over. We usually reserve that for some of the bigger type surgeries, but we've done it for single implants, we've done it for single extractions, we've done it for people who are so apprehensive that whether we're just doing some fillings and crowns and cleanings on them, we can do it with that as well. So yes, we do offer multiple levels of sedation. Do they hurt? Again, I kind of mentioned that a little bit earlier. They really don't hurt overall. You're going to be sore for a couple days. If you've ever had a tooth removed, it's kind of like having a tooth removed. During the procedure, we make sure that you're completely numb. We'll give you some longer lasting anesthetic for afterwards. So, for a few hours afterwards, it will be sore. Depending on the situation, you might have a little bit of bruising internally, rarely externally, if we're just dealing with one implant, but overall, no. And again, we try to control it with making sure you have antibiotics, pain medication if we need it. We use a whole slew of different things to make it as comfortable as possible. Any other questions? I think that's it. So I appreciate all of you joining. Have a great Tuesday. It is Tuesday, and we'll see you on the next one. Thank you.